Hello everyone, welcome to Pediatrics by Dr. Anand. Let's start off this class, and before starting any segment we always have a quote. And what is the quote for today? The quote for today is, जब आप खुद को तराशते हैं, जब आप खुद को तराशते हैं तब दुनिया आपको तलाशती है. जब आप खुद को तराशते हैं तब दुनिया आपको तराशती है, तो अपने आप को तराशते रहें. The most common opportunistic infection that occurs in children infected with HIV, which is the most common opportunistic infection occurs in children infected with HIV. It is pneumocystic cerevisiae. Pneumocystic cerevisiae is a one-liner question. Is the most common infection which is infected with people who are suffering from HIV. Simple. Cystic fibrosis. What are the three important points? Number one, we can appreciate. Number one, that it is autosomal recessive inheritance. Number one, it is autosomal recessive inheritance. Number two, a mother while kissing her child, found her child's skin salty tasting. A mother while kissing her child found her child's skin salty tasting. Number one. And which problem is there? Chloride channels. Basically, the main channels are affected are the chloride channels. And what is the hallmark of cystic fibrosis? More than 60 sweat chloride levels. Sweat chloride levels more than 60 is the cutoff, which is the hallmark for cystic fibrosis. So it is an autosomal recessive inheritance. That is the important point. It is the major cause of severe lung disease and most common cause of exocrine pancreatic deficiency in children. Well, exocrine pancreatic deficiency means the pancreatic enzymes, basically they are not working properly, and all the pancreatic enzyme from the pancreatic duct is coming out of my body. So the patient will have a foul smelling not like a foul smelling stool. The patient is going to have a steatoria. Foul smelling stool in the patient will have. Anyone who is having a foul smelling stool means pancreatic enzymes are not working properly. They are not getting absorbed properly. They are just coming out of the body. Okay. Next, cystic fibrosis affect the respiratory tract by causing an excess production of the viscous mucus by the bronchial glands. That's true. All the secretion gets stuck. 100 बात की एक बात याद करनी है. All the secretion gets stuck. That's it. And that basically forms the mucus plug, and that obviously can obstruct the terminal airways of the respiratory system, and it can cause upper respiratory tract infection, lower respiratory tract infection. It can cause bronchiectasis. All the secretion gets stuck. It can cause bronchiectasis, and all these mucus plug can cause a nasal polyp. All this mucus plug sticking together can cause a nasal polyp. So foul smelling stool, star mark MCQ. Chloride channels more than 60 millicurie per liter MCQ. Autosomal recessive, salty tasting, and bronchiectasis and nasal polyp are the MCQs. Remember that. Okay. बहुत अच्छे से पढ़ाई करनी है. इमेजिन कुछ मार्क्स के लिए दोबारा 6 महीने रिपीट्स नहीं करने. यू मस्ट वर्क हार्ड ब्यूटिफुली, एंड मोर देन द हार्ड वर्क, स्मार्ट वर्क प्लेज अ वेरी इंपॉर्टेंट रोल, बिकॉज इट इज़ एक्सट्रीमली टॉर्चरिंग टू सिट अगेन फॉर द सेम एग्जाम, वॉचिंग द सेम शो, सेम lecture again. Just I could not clear last time. So first attempt is the best attempt, and whichever attempt is yours is your best attempt. Dehydration in a child can be divided into mild, moderate, severe. That's right. And now we say no dehydration, some dehydration, and severe dehydration. For no dehydration, what do you give? For no dehydration, we give zinc and ORS. For no dehydration, we give zinc and ORS. And how do you know the child is having moderate dehydration or some dehydration? He'll be very thirsty. In your MCQ, the child will be very thirsty. Whereas in a case of severe dehydration, he'll be lethargic and unconscious. That's right. He will have sunken eyeballs, decreased urine output, and skin turgor more than 2 seconds, and refusal to feed. So sunken eyeballs can happen in some dehydration also and severe also. Decreased urine output also, some and severe, both it can happen. But refusal to drink will be a severe dehydration, star mark, and thirsty baby eagerly drinking the bottle of water, some dehydration, star mark MCQ. What is the fluid of choice you give for some dehydration? Like moderate dehydration is some dehydration. Basically now we give very importantly is nothing but ORS. So some dehydration ke liye will give ORS at the rate of 75 ml per kg. ORS at the rate of 75 ml per kg. Choice of the fluid we give for some dehydration is ORS at the rate of 75 ml per kg. Rotavirus. Rotavirus is the most common agent responsible for infantile diarrhea. Yes, which is the most commonest cause of diarrhea? Rotavirus. Which is the most common bacteria causing diarrhea? The bacteria causing diarrhea is E. coli. And which is the most commonest cause of urinary tract infection in pediatric age group? The answer is E. coli. What is the total osmolarity of the WHO recommended ORS? The WHO recommended ORS is 245, where sodium is 75 and glucose also is 75. Potassium is 20, citrate is 10 and chloride is 65. Citrate is 10 and chloride is 65. This is the whole osmolarity. Total packet osmolarity is 245 milliosmoles per liter. अच्छा आगे आ गया. Sodium is 75. That's right. अच्छा, what is the dose of drink in a case of diarrhea? So okay, less than 6 months baby we give 10 mg, and more than 6 months baby we give 20 mg. Less than 6 months 10 mg, more than 6 months 20 mg, and zinc is given for 14 days. Zinc is given for 14 days. Okay, SAM. What is SAM? SAM is severe acute malnutrition. Indicators of SAM, or what are the components in SAM? We have acute malnutrition, chronic malnutrition, and acute and chronic malnutrition. Acute malnutrition is known as wasting, and chronic malnutrition is known as stunting. Remember the mnemonic World Health Organization, WHA, W for weight, H for height, and A for age. If there is decreased weight for height, if there is decreased weight for height, that is known as wasting. W for weight, W for wasting. If there is a decreased height for age, if there is a decreased height for age, that is known as stunting, chronic malnutrition. And if there is a decreased weight for age, that is known as acute on chronic malnutrition, or also known as underweight. Remember that. Okay. Okay, and what about the mid upper arm circumference? So we have the three color Shaki tape: red color, yellow color, and green color. Mid upper arm circumference is calculated by the Shaki tape: red, yellow, green. If the mid upper arm circumference is less than 11.5 centimeter, the baby is coming in red color Shaki tape. That is severe malnutrition. And less than 12.5 mid upper arm circumference is yellow color Shaki tape, and more than 12.5 centimeter mid upper arm circumference is green color Shaki tape. Shaki's tape is used to assess the mid upper arm circumference in children. That's right, we have done that. Okay, okay, Kwashiorkor and marasmus, how do you differentiate? Remember, Kwashiorkor is condition there is a deficiency of proteins, whereas marasmus is deficiency of proteins plus calories. Marasmus is deficiency of protein plus calories. Kwashiorkor is only deficiency of proteins. Okay, what are the important points you see in a case of what you call Kwashiorkor? One important F is there, flag sign. Hair follicle is there, shiny dull parts of the hair follicle, that is known as flag sign, that you see in a case of Kwashiorkor. Altered white and dark bands occurred along a single strand of hair. So white, shiny dull parts of the hair follicle is nothing but the flag sign seen in Kwashiorkor. Black color stool is known as melena. It is a upper GI bleed. And fresh blood in the stool is hematochezia. It is a lower GI bleed. And what is the demarcation point of upper GI bleed and lower GI bleed? It is ligament of Treats. Ligament of Treats is a demarcation point जहाँ पे duodenum खत्म होता है और jejunum चालू होता है. At the duodenojejunal junction, we have this ligament known as ligament of Treats. Above the bleeding, above problem is upper GI bleed, and below the level of ligament of Treats is a lower GI bleed. Okay, retinoic acid is a teratogenic drug that causes cleft lip and palate in the newborn if taken by the mother in pregnancy. It is an MCQ actually. So retinoic acid, is the one drug if mother has taken that will cause what you call problem to the baby cleft lip and palate. And for that, what is the surgery for that cleft lip and palate? Chyloplasty. Chyloplasty is the what you call surgery name for cleft lip and palate. Okay, sucking is a major concern in children with cleft lip as nutrition is compromised. Naturally, cleft lip is there, no? So sucking will be a very big problem. Post cleft lip repair, a child should be positioned at the side or the back to keep them from rubbing their face in the bed. So basically, after the cleft lip repair, either the right lateral or left lateral, they should be positioned at the side or back to keep them rubbing from their face in the bed. and post cleft palate repair, child should be placed in the prone position. So P for palate, P for prone position, remember that. And cleft lip repair if you're doing, very importantly. So okay, then for that you have to keep the baby on the back, or you have to keep the baby on the side position. Okay, yeah, okay, that's fine. Okay, tracheoesophageal fistula, this we have done very importantly. TEF, tracheoesophageal fistula, is, we know it's an abnormal opening between the trachea and the food pipe and windpipe, trachea and the esophagus. There is a fistula. How the patient will have, whatever the mother will feed the child, baby will vomit, he will vomit, he will have aspiration. Achha, this is also MCQ, choking, kind of a choking during feeds, and he's gonna have a lot of aspiration will happen. That is one thing. Which is the most commonest type of tracheoesophageal fistula? The mnemonic is CAD. The most common is C, followed by A, and the least common is D. That you should know. Okay, and then very importantly, yeah, this part is done. Okay, normal enteral feedings are flushed with water to open the blocked tube and ease feeding, but in NICU it is done with air. Okay, normal enteral feeding, if you're doing, normally you push with water so that the tube gets open, but in the baby, because the fluid is very precious, can't give over fluid, so we just push that blockage with the air. A nurse should check the placement of the Ryle's tube every time before the feeding. Yeah, that's an MCQ actually. The nurse should check the placement of the Ryle's tube every time before the feeding, and even while giving the next feeding, you have to aspirate little first, whether to see is there any pre-gavage residue, basically to see whether the milk which you gave at 10 o'clock has been absorbed, has gone down or not. Okay, so that also is important for every, if I'm giving feed at 10 o'clock, then I gave at 1 o'clock. At 1 o'clock, I will again little re-aspirate to check whether whatever I gave at 10 o'clock, has it gone down? Has it absorbed properly? Like that. If there is a more than, if there is more than 50% is coming out of whatever I gave at 10 o'clock, more than 50% is coming out at 1 o'clock during the aspiration. So that time I will hold that feed, and again I will try to do it at 4 p.m. Try to give the feed. Phenylketonuria, we all know, number one, all the inborn errors of metabolism are autosomal recessive inheritance. There's a deficiency of the enzyme phenylalanine hydroxylase, and yeah, phenylalanine get converts into tyrosine by the enzyme phenylalanine hydroxylase. If phenylalanine hydroxylase is not there, the phenylalanine will not get converted into tyrosine. So lot of phenylalanine, increase amount of phenylalanine will be there, and decrease amount of tyrosine will be there. So all these patients will have mental retardation and all that, but blonde hair, something is important. Blonde hair, fair skin. So phenylketonuria, like अंग्रेजों की तरह skin होती है, very fair skin and blonde hair, and mental retardation, developmental delay are the symptoms for this. Okay, failure to pass meconium within first 24 hours may indicate of Hirschsprung disease. Yeah, baby should pass stool within 24 to 48 hours. 24 to 48 hours. So if instead of 24, I can say 48 hours. Failure to pass meconium within 48 hours upwards may be an indication of Hirschsprung disease. Hirschsprung disease is also known as congenital megaganglion, and it is a disorder characterized by absence of the nerves in the part of the intestine. We all know that ganglion cells एक segment में नहीं होता. There is absence of ganglion cells in one segment of the bowel. That is why no ganglion cells, no peristalsis, so the baby end up having constipation. It is the most common abdominal emergency of early childhood is intersusception. The most common abdominal emergency of the early childhood is intersusception. Now intersusception is different. In the Hirschsprung disease, there is an absence of ganglion cells in one part of the bowel, whereas in a case of intersusception, one part of the bowel has gone into the another part of bowel in the bowel, and that is why you will have a kind of a coiled spring sign. They ask in exam, where do you see claw sign or coiled spring sign? The answer is intersusception. There are various types of intersusception: ileocolic, colocolic, and ileoileal. And remember, ileocolic is the most common form of intersusception, star mark MCQ. And how the patient, how the patient will come when one part of my intestine has gone into the another part of the intestine. Remember the mnemonic PPR, that is pain abdomen, palpable mass, and red currant jelly stool. Pain abdomen, palpable mass, and red currant jelly stool is a triad of the intersusception. intersusception. And this red currant jelly stool, remember, it is painful, okay? In your MCQ, the patient will have a painful rectal bleeding, then you will think of intersusception. Painless rectal bleeding, I would have thought of Mickel's diverticulum. Irritable bowel syndrome is characterized by ribbon-like stool. So red currant jelly stool, intersusception, ribbon-like stool, it is irritable bowel syndrome. A child came with bilious vomiting on day 2 of life and mother with a history of polyhydramnios. If the mother has polyhydramnios and he is having bilious vomiting, you can think of duodenal atresia. And what is the X-ray finding of duodenal atresia? The D for duodenal atresia, D for double bubble sign. D for double bubble sign. MCQ. Where do you see double bubble sign? The answer is duodenal atresia. Done. Has everyone understood this much? Yes. बहुत अच्छा होगा. बहुत 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 अच्छा होगा. Be very positive. Be very positive. बहुत अच्छा होगा. All you have to do is just before opening the paper, my dear friends, there are करोड़ों लोग इस शो को देख रहे हैं. Before opening the paper, 5 deep inspiration, hold the breath, followed by expiration. 1, 2, 3, 4, 5. Slowly inhale. 1 and 2 hold. 1, 2, 3, 4, 5. Exhale. बहुत अच्छा होगा. Relax yourself. Okay. Very good. Has everyone understood this much? Yes or yes, yes? Okay. Very good. Great, great, great. अच्छा, okay. वो गाना नहीं बोला. हम होंगे कामयाब, हम होंगे कामयाब. I want everyone to sing with me and जो sing करेगा उसी का ही clear होगा. तो जल्दी शुरू करो. क्या है गाना? हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. So, congratulations, you clear the exam. So, jaundice, छोटे बेबी में डॉक्टर jaundice कैसे बढ़ता है? ऊपर से नीचे आता है कि नीचे से ऊपर आता है? How does the jaundice progress in a newborn baby? Please remember, jaundice appears in cephal to caudal position progression. पहले चेहरे पे आएगा, फिर बॉडी पे आएगा, फिर पैर पे आएगा. Cephal from the upper limb, caudal to the lower limb. It's an MCQ. Within 24 hours of life, my baby is yellow. You'll think of pathological jaundice. More than 24 hours of life, you will think about the physiological jaundice. Okay, that you should know. The staining of the nappies in clay color stool. This is important. Clay color stool. Clay color stool means we are talking about conjugated hyperbilirubinemia. Conjugated hyperbilirubinemia because conjugate bilirubin can get excreted by the kidneys and the patient can have a dark urine, staining of the nappies and clay color stool. Now, obviously, it is pathological jaundice. And pathological jaundice, yeah, that's right, may persist. Pathological jaundice may persist beyond 3 weeks, whereas physiological jaundice doesn't persist beyond 3 weeks. So, till 3 weeks tak chalega, so that is physiological. After 3 weeks, it will be a pathological. Means pathological jaundice either will happen within 24 hours of life or will progress till after 3 weeks, 4 weeks, 5 weeks, like that. Okay, that's it. Now there's something known as breastfeeding jaundice and something known as breast milk jaundice. जितना मम्मी अपने बच्चे को दूध कम पिलाएगी, जितना मम्मी अपने, अच्छा breast feeding हो गया, दूसरा है breast milk jaundice. The less the mother will feed her baby, okay, the less the mother will feed her baby, the baby will land up into a problem known as breastfeeding jaundice. The more the mother will feed her baby, the more the mother will feed her baby, the baby will land up into jaundice known as breast milk jaundice. जितना अब मदर अपने बच्चे को दूध कम पिलाएगी, बच्चा jaundice होगा, उसको बोलेंगे breastfeeding jaundice, seen in the first week of life. Whereas breast milk jaundice is nothing but the more she will feed her baby, the baby will land up into jaundice. That is seen when after 7 days. 7 दिन के बाद में 7 to 14, 21 days तक भी आप देख सकते हो. From second week onwards till 2, 3, 4 weeks also you can see this breast milk jaundice. Sir, you said the more the mother will feed her baby and the baby will have jaundice. So means should she stop her breastfeeding? The treatment for this option will be never stop the breastfeeding. Never stop the breastfeeding because the benefits are more than the risk. So never stop the breastfeeding as the treatment protocol of the breast milk jaundice. You can give phototherapy, but stopping the breastfeeding is not the right answer. Next, अच्छा, breast milk jaundice occurs late after 1 week. Yes, I told you, and it is because of excessive breastfeeding. That's right, and there is an enzyme known as beta glucuronidase. This fellow is responsible for that. Phototherapy, we all know it is a visible light to treat the jaundice in the baby. Definitely, you have to, we have to cover your eyes and genitalia of the baby. That is important. Strict temperature monitoring is important because, and fluid intake also should be increased. Actually, this is also nice. Fluid intake should be increased, okay, नॉट डिक्रीज, क्योंकि इतनी नीली बत्ती में ना बच्चा बहुत गर्म लाइट होती है तो डायरिया डिहाइड्रेशन हो सकता है. सच अ हैवी ब्लू लाइट एंड इट्स अ हॉट लाइट, द बेबी कैन हैव अ डायरिया डिहाइड्रेशन. सो that is one reason the fluid intake should be increased, not decreased. It's an MCQ, I saw it. Okay, reposition the child every 2 hours early and encourage the exclusive breastfeeding if not restricted otherwise. That's true. अच्छा, बच्चा और मशीन में डिस्टेंस कितना होता है? व्हाट इज द डिस्टेंस ऑफ द मशीन एंड द बेबी? सो रिमेंबर 30 to 45 सेंटीमीटर. 30 to 45 सेंटीमीटर इज द डिस्टेंस ऑफ द बेबी एंड द मशीन, एंड द पावर ऑफ द मशीन इज 30 microwatt. 30 microwatt will be the power, and the phototherapy wavelength will be 450 nanometer. Proper will be 450 to 490 or 440 to 460. मतलब ये range होता है. This is a range, okay? So choose the closest best answer. Please have breakfast in the exam. Have curd. Touch your parents' feet. Go to temple. Relax. Open your brains and then give the paper. Okay, it will be fun. It will be very nice. Last segment, Apgar score. We all know that Apgar. Sir, Apgar score, it is for the gestational assessment of the baby or clinical assessment of the baby? I want to know clinical assessment of the baby. We use a scoring system known as Apgar score. Number one. What is the second question? What is the full form of Apgar score? It is appearance, pulse, grimace, activity, and respiration. Appearance, pulse, grimace, activity, and respiration. Is it a part of the neonatal resuscitation? No, neonatal resuscitation is different. Term, tone, cry. If it is crying well, routine care. Not crying well, initial steps. Then not crying, check the heart rate. So that is like Apgar score is not a part of neonatal resuscitation. Apgar is different and neonatal resuscitation is different. Acha, appearance, pulse, grimace, activity, and respiration. Is respiratory rate a part of the Apgar score MCQ? No, respiratory rate is not a part of the Apgar score, and we have scored like 0, 1, and 2. 1 will be a perfectly happy baby and 0 will be a dead baby. So what is the normal Apgar score? The normal is more than equal. So the normal is more than 7. More than 7. Instead of more than equal to 7, it is more than 7. More than 7 is the normal Apgar score. 4 to 7 will be moderate birth asphyxia, and 0 to 3 will be severe birth asphyxia. So 4 to 7 is moderate birth asphyxia, and this is MCQ. All these are MCQs. Remember that, okay? And 0 to 3 is a severe birth asphyxia. Okay, that you should know. So these are the important points. We'll take a quick break over here. So that's it. These are the beautiful points must appreciate for the exam purpose. And before again, लेट्स हैव अ क्विक होल्ड. ओके, एक बड़ा अच्छा सा वो था ना, मैंने सुनाया था वो कहानी कि हिंदी में है वो एक्चुअली. तो क्या होता है कि एक बहुत बड़ा जंगल होता है, उस जंगल में आग लगी होती है. जब उस जंगल में बहुत बड़ी आग लगी होती है तो एक चिड़िया होती है, बहुत दूर से पानी भर के अपनी चोंच में ना आग को बुझाने की कोशिश करती है. एक चिड़िया बहुत दूर से पानी लाके अपनी चोंच में और इस आग को बुझाने की कोशिश करती है. चिड़िया की इस कोशिश को करता देख लोग चिड़िया का मजाक बनाते हैं और कहते हैं, अरे चिड़िया, तुम्हारे छोटी सी कोशिश से क्या होगा, इस जंगल में बहुत बड़ी आग लगी है. चिड़िया कहती है, जब इतिहास गवाह होगा तो 3 तरह के लोग माने जाएंगे. एक वो जिन्होंने ये आग लगाई, एक वो जो इस आग को लगता देख खड़े थे, और तीसरे उस तरह के लोग जिन्होंने इस आग को बुझाने में मदद की. तो चिड़िया कहती, मैं उन लोगों में से जानना चाहूँगी जिन्होंने कोशिश तो करी. तो दैट्स व्हाट, कोशिश करने वाले की कभी हार नहीं होती, और ऐसे थोड़ी थोड़ी कोशिशें करते रहें ज़िंदगी में. ये एग्ज़ाम क्या, हज़ारों करोड़ों अरबों एग्ज़ाम ऐसे हो जाएंगे, तो ज़्यादा स्ट्रेस नहीं लेना. सो विल टेक अ क्विक ब्रेक, देन विल स्टार्ट अगेन. प्लीज़ टेक केयर एंड थैंक यू.